Welcome to the Triage Method podcast with me, Gary McGowan, and my co-host, as always, Mr. Patrick Farrell. Paddy, how are you?
I am positively splendid, Gary. It's a very sunny London at the moment. I don't know how it is down there in Cork, but London, it's 20 degrees. It's only 10:30, so I'm happy.
Surprisingly nice here in Cork as well, so may it last.
Phenomenal. Anyway, Gary, we're not here to talk about the weather. We are here to talk about something that sounds like really, I don't know, cliche or catchphrasey or whatever, right? But it's the top 10 things that you learned while studying to become a doctor, right? Now, I presume, I'm going to go out on a limb here and presume that you learned more than 10 things studying to be a doctor. I would hope at least.
Few more,
Uh,
yeah.
yeah, and you did quite well. You're now a certified, qualified, whatever, doctor. So we should actually be introducing you as Dr. Lord Gary McGowan. Um, but anyway, that's what we're here to talk about. So maybe you want to just, congratulate yourself for a few minutes about becoming a doctor. Maybe you want to talk about that experience, and then we can kick this off for real and discuss those top 10 things you learned while studying to become a doctor. And obviously, that's part of explaining the process.
Yeah, so for those of you, like maybe you're newer to the Triage podcast, just give you a bit of background about where I'm coming from here. So obviously, I have a background in fitness and a background in clearly lifting weights because of how jacked I am. But no, I have a background in personal training. Okay, so that's what we've been doing for many, many years now, is helping people get fit and do so in a science-based, evidence-based manner to make their lives as easy as possible and integrate fitness into it. That's what we do at Triage. That's what we've always been doing. Okay, so that's where I'm coming from. That's my perspective. And I also did physiotherapy previously, so that was my previous degree, which obviously has some healthcare elements associated with it. And then also, I was a graduate entry student into medicine, so I wasn't coming in out of leaving cert. I was coming in with a little bit of, maturity, a bit of life experience, and of course that previous degree and the personal training experience. So it's a little bit of a different maybe pathway into medicine or mindset going into medicine than some other people might have, because I was probably going in maybe with maybe a philosophy of health, an understanding of some of the basics of health and things like nutrition and training understanding that maybe other people wouldn't have. So that gives me maybe a little bit of a better perspective, maybe better in some ways, maybe worse in others. Okay, so that's where I'm coming from, and as a result, what I want to do now, you're obviously primarily a fitness audience listening. I want to discuss those kind of top 10 things that I've learned along the way that I feel might give you an insight into how I think about health now from my perspective, but also give you an insight into how that gap between fitness and medicine can be bridged, because that's something that is a core long-term mission for us at Triage. Okay,
Yeah,
so
I suppose just before you get into it, we should kind of also state that is the goal at Triage. We basically want to make personal training, we'll say, we want to make this a kind of frontline healthcare component, right? I don't think it is as supportive of people's health as it could be, the personal training industry, I mean, or the health coaching industry. And I think we can do a lot more to ensure that people actually reach their health goals, people actually, reach their best self, with health habits, we'll say, training, nutrition, sleep, stress management. And there are other things that we do want to push we'll call it this kind of like preventative medicine sphere, because a lot of the things that we talk about, they are actually incredibly beneficial for, preventing disease. And that's where we kind of want to see the business moving, at least over the next couple of years, and that's the vision at the moment. So that's the perspective of Triage. Gary, what are the top 10 things you learned?
yeah, so firstly, one that's intrinsically related to fitness, and that is that just because you lift weights and eat a healthy diet doesn't mean you don't need to see your doctor. It doesn't mean that you should be avoiding medication. It doesn't mean that you don't need basic health interventions like, vaccines and things like that. These things are still important. So in many cases, medication is still required for people who are super healthy in terms of their training and nutrition practices. Examples of things where that would come in would be, let's say your diet's already in a good place, you're exercising already, and now you've got high blood pressure. The diet seems to be good, the training seems to be good, but that blood pressure is still high. The fact that you train, the fact that you eat well does not negate the risk of that high blood pressure long term. Similarly, something like cholesterol, if you have a high level of LDL cholesterol, that can be familial. It can have genetic contributors. And sometimes, or in many cases, diet will not be sufficient to get that to the optimal range to preserve your health long term. And the problem is that for many people, they become so entrenched in health and fitness and preventive health practices through training, nutrition, supplementation, etc., that they have an inherent bias against any sort of medical intervention. I understand that because I felt that in the past myself. I've believed that in the past myself. And I know that a lot of personal trainers are in a similar position. It makes sense. This is your bread and butter, training and nutrition. And if you don't understand, for example, the etiology of disease, it might be easy to think, well, yeah, exercise can just prevent all these things. Because when we think about high blood pressure, if in many cases blood pressure is related to lifestyle, but there are also genetic contributors to high blood pressure. There are different variations, like the level of aldosterone that you have, different hormones that can contribute to your blood pressure. So you can't be guaranteed that exercise and nutrition is going to be sufficient. So if you have this bias against medicine just across the board, then you might actually leave yourself in a worse position with your health, despite doing all of these things proactively.
Yeah, and I think this is one of the things that is really important as personal trainers or as individuals. It's really important to understand, because the way, I don't know, we call it the health and fitness stuff is marketed, training, nutrition, sleep, stress management. Like, you can kind of be left thinking that this is a panacea, and to an extent it is, right? I think all of those interventions, those foundational habits as we often call them, they are the baseline. They are the foundational stuff. You don't get to just opt out of them. If you opt out of any of them, you probably are more likely to, be in a diseased state, reach some sort of illness, right? So it doesn't negate that if you then say, oh, well, I also need medication, right? It doesn't stop them being a panacea, right? The way I kind of think of it, the conceptual framework I use, I'm like, right, all of these things, they seem to be really, really effective for a multitude of different ailments in a preventative perspective, and then also even in a treatment perspective, Like, very often people discuss training and nutrition, and they're like, right, this is going to help with your cholesterol, this is going to help with X, Y, Z, right? And they do, right? Training especially seems to be an incredibly potent, intervention, incredibly potent. If you could make that into a drug, you'd be like, wow, this is phenomenal. Same with sleep, same with good nutrition, and same with stress management, right? So if you could put them all into a drug, into a pill form, you'd be onto a winner, right? But they're still shotgun approaches, right? They do a lot of different things. Some of the things they do incredibly well, like if you're trying to manage, I don't know, your blood sugar, for example, exercise, phenomenal tool for that, right? Has all these other things as well, right? Does all these other things. It's a shotgun approach, right? However, you don't always need a shotgun, right? Sometimes you need a sniper rifle, right? Sometimes you need to be incredibly precise in terms of what you're dealing with, right? You're going in clearing out trenches, shotgun, phenomenal, right? That's great, right? You're clearing out a room potentially, phenomenal. But if you're clearing out a room and all you have is a shotgun and there's families in that room, you probably don't want that shotgun, right? There's going to be a lot of collateral damage, right? So we have these shotgun approaches, phenomenal tool, great. We should all be using them. We should all be doing health habits, these foundational habits that we discuss. But sometimes we need something more precise. Sometimes we need something more specific, right? And in those cases, that's medical intervention, drugs. I think depression is a really good case for this, because you can have, whatever about the high blood pressure or cholesterol, people will, almost always say like, oh, diet, nutrition, training, they're the tools we should be using for those. And yes, they should be part of the toolbox. But I think for stuff like depression, right? Very often people say, oh, well, you just need to do these like foundational health habits and you're going to prevent depression, right? And that's just not the case. Like, for example, yourself, not to bring in your case specifically, but like, you were doing all these things, right? And you still have this, classification, we'll say, of having high functioning depression, right? So what are you going to do? You're going to train more. That might be something that you want to do, which, but what are you going to do? Like train more. You're already training, whatever, that's 10 hours per week, right? Still have depression, right? What are you going to do? Eat a better diet, eat, higher quality diet. You're already eating a good diet. You're already doing all those things, Oh, sleep more. Like maybe you could probably sleep more. You've been, especially with all the different things that you've got going on, sleep could definitely be improved, but it's not like you're sleeping 2 hours per night every single night, right? So you're already doing a lot of these different things. And again, you can make an argument that doing a little bit more of them, that would be good. But very often it isn't. Like, you need some more targeted intervention. For some people, that might be something like, some sort of talk therapy, right? Where they're just talking to someone, right? For other people, it might be medication, right? So we have tools available to us. One of those tools is all those foundational health habits. I'm biased towards them. I think they're phenomenal tools, but that doesn't negate the fact that we have other tools available to us. And for certain populations, at certain times, those other tools may be more beneficial, maybe exactly what's needed, and it isn't just exercise, nutrition, whatever.
Absolutely. So that brings us to number 2, which is that no intervention is without risk. This applies to medicine, it applies to surgery, it applies to nutrition, and it applies to training. Okay. So anytime you think about health intervention, you have to consider the pros and the cons. Okay. What's the likelihood that I'm going to benefit from this intervention? And what's the risk associated with this intervention? And then other things like economic factors, local access to the intervention, etc. Okay. So, for example, people often think that, if I have surgery for my joint pain, right? Like, let's say I have a torn meniscus. Okay, surgery is obviously a great call, fix it. But not always, okay? So sometimes you can have surgeries for different joint problems that lead to further problems down the line. That might be worth it in the short term, if you're an athlete and you need to get this sorted right away. There might be cases where the benefits are really marginal and they'd only be worth it for some people and not others. There might be cases where if you intervene, we don't know if this, let's say it's a small lump or small tumor, we don't know if it ever would have caused someone harm, but it is something that the person feels they need to get rid of. It could cause them harm in future. What age are they? What's the surgical procedure like? What's their health like otherwise? And so on. This goes for medicine as well. Of course, the big topic of the last couple of years have been related to vaccination. Suddenly talking about health risks, or risks associated with different interventions, was very much at the front of the public mind. And unfortunately, what you see is a lot of media representation of the any complication that occurs. So, for example, if you see an anecdote of this person had, a COVID vaccine, or I probably shouldn't be using the word vaccine because it actually disincentivizes our podcast. But anyway, you have the COVID vaccine, and this person then got a stroke, let's say 6 months after. That story then gets amplified in the media, and suddenly there's this idea that this is an entirely unsafe intervention, even though that might actually be an understood risk by the medical profession. And very often, if you actually listen and you're attentive, even if you're looking at something like Panadol, you're looking at antibiotics you're taking for a chest infection, or you're going for a very minor surgery, there are always risks that are made clear. If you read the risks in any medicine packet that you get, if you read the information leaflet, you'll see risks that are there. There'll be common things, there'll be rare things, and there'll be exceedingly rare things. And that's just something that you have to accept anytime you're engaging with medicine, anytime you're engaging with surgery, and also extends to the things that we often think are a lot more benign. So, for example, there are cases every single year of people that end up with liver failure and sometimes die because of contaminated supplements that weren't regulated properly. And even the things that people think are so benign, like herbal medicines, There's a lot of that in India, for example, with Ayurvedic medicine that's quite popular in India. And there's a hepatologist, a liver doctor that I follow on Twitter, who's constantly sharing these case reports from these supposedly benign or natural supplements and medicines that have caused his patients to have liver failure. So don't be fooled by the idea that something is natural. Don't be fooled by something not being made by pharma. There are risks of pharma, there are risks of surgery, there are risks of supplementation, and there are risks of exercise. Less so, but they still exist. Okay? So any intervention is contains risk. And you need to understand what that risk is for you. And often that means collaborative decision making with a healthcare professional. And unfortunately, you just can't, you're often not going to be able to improve your health or get out of a state of disease without some risk associated with it. And that's just the nature of medicine.
Yeah, and this is really important to understand as a personal trainer, but obviously as an individual, just yourself. Like, first of all, people have different risk tolerances. Some people are going to be more accepting of higher risk things than other people. Like, for example, going under anesthetic, let's go for a general anesthetic. You'd be like, right, it's relatively fine, like most people aren't going to die, but there is a non-zero chance that you could die and just never wake up from an anesthetic. It happens. There's systems in place to minimize that happening, but it happens. You've different like genetic mutations, different, we're basically just using we think based on your body weight, based on, general metabolism, this is enough of a dose. Could be too much for you, right? Could be too little for you. You hear these horror stories of people, being effectively paralyzed, but they're awake during surgery and they can feel absolutely everything. They just can't move their body, right? So like, even though, if you're going for some sort of surgery, some sort of, intervention, whatever in a medical sphere, maybe you go under general anesthetic and you're like, that's an okay trade-off. That's fine for me. I have to do it. I'm getting a colonoscopy. I don't want to be awake for that, right? Cool. But you might not be okay with that risk if you have to go under a general anesthetic for, I don't know, something like breast augmentation. You're like, okay, yeah, I would like to have bigger boobs, but I don't want to go under a general anesthetic. I don't want to increase my risk of dying of some anesthetic related complication, right? And this also applies to nutrition. It also applies to training, right? Training, I think, is a little bit easier to understand. You're like, okay, well, these moves are a little bit higher risk. Maybe I don't do those. Maybe, I'm a 70-year-old individual. I'm not doing like snatches on a Bosu ball or something like that, right? You're like, okay, look, that's, if I fall from this and break my hip, there's a strong chance I'm going to be dead, right? So you're like, okay, you can understand that risk. You can understand that. You can be like, okay, I'm going to minimize the risk of, catastrophic exercise failure or issues occurring, especially in the gym. It's very safe. But when you're in a sporting context, it's chaos, right? You've torn 2 hamstrings, doing Brazilian Jiu-Jitsu, right? Now that's largely because you're pretty bad at it, but it's a non-zero risk that you're going to get injured when you go to something like Brazilian Jiu-Jitsu, right? Injuries are quite common in a combat sport, especially one that you have to actually physically touch someone all the time. Like whatever about say boxing or striking or whatever, like you can effectively just get out of the way, and if you're really good, literally never even touch your opponent, or rather your opponent never even touches you, right? Like that can happen. In something like grappling, not the case. You kind of have to, you actually have to touch them, right? But something like football, people are like, oh, yeah, football, I'll let my kids play football, it's fine, right? Football, like such a huge risk injury, like so many injuries you can get from having a little kickabout, right? So many potential injuries that you could get. You see it all the time, both in like professionals and semi-professionals, and then obviously just recreational footballers. So there's an injury risk there, and you might think, oh, it's just football, right? But again, that comes back to your risk tolerance, right? As personal trainers or coaches or whatever, this is really important to understand, because your risk tolerance might be completely different than the person you're coaching's risk tolerance, right? Or if you're just a consumer of health and fitness information, again, your risk tolerance might be completely different than the person who's trying to sell you something or trying to give you information about XYZ topic. Their risk tolerance might be completely different than yours, right? Someone might say, oh yeah, like a high saturated fat diet is perfectly fine to eat. I eat like a carnivore diet, lots of butter, whatever, right? And they might be like, okay, I'm willing to be an experiment. I feel like maybe they do feel better eating a diet like that, right? Maybe they actually have all these different genes that actually protect them from having high LDL, right? They're just like, right, even if I did have this super high LDL, it's actually not an issue because I have all these other protective genes or whatever, right? But that doesn't mean that that's your risk tolerance. That might be okay for them, but that doesn't mean that it's okay for you, right? And that's a bit of an extreme example, but even something that, a lot of personal trainers use, like nutrition, is something that we teach on our like nutrition course as well, is, the use of stuff like, tracking your calories and macros, right? You might be like, fairly benign intervention. It's just understanding the caloric and macronutrient, whatever it is, the content in food. How is that a bad thing, right? But a lot of people get eating disorders as a result of calorie and macro tracking, right? Now, you could argue that maybe they had a disordered eating pattern or whatever before that, and that just, the calorie and macro tracking just exacerbated the issue or facilitated that issue. But either way, it is still a potential risk from something as, benign as calorie and macro tracking. Like, you might literally have or do calorie and macro tracking with every single individual that walks into your doors as a personal trainer, right? And if that's the only tool you have available to you, you're not serving your clients the best that they could be, because again, it's a non-zero risk intervention. There's going to be individuals that it's not just their preference that they don't do that. It's actually something that could really severely cause harm for that individual if they were to do that, or they even have evidence of that. Like, previously, like I've had a lot of clients who've previously done like calorie and macro tracking, and it's led to, or again, facilitated like severe mental health issues, right? So again, no intervention is without risk.
Absolutely. And that's a good segue into number 3, which is nutrition and training are not taught. And here's why that might actually be okay, because this is important. In the fitness industry, people talk about this all the time. They say doctors don't know anything about training and nutrition. And to some degree, that's true, depending on the profession, as people specialize into different areas, they'll know more or less about different caveats or different areas of nutrition or training that might be of relevance to them. For example, if you're going to a cardiologist that specializes in like lipidology, they're probably going to know a bit about the way diet impacts LDL and atherosclerosis risk, etc. If you go to a diabetes specialist, they're probably going to know about a bit about the way diet and exercise is important there. But the reason I say it's okay, as someone that's very biased towards exercise and nutrition, is that there are other professions, This is the whole point of us trying to elevate the profession of personal training, and for personal trainers to play a bit more of a frontline healthcare role. Because the ideal is that your cardiologist, your neurologist, etc., that they don't have to learn about training and nutrition very much, because they can say, I know a local personal trainer, or I know a local physio, or I know a local nutritionist or dietitian here in the hospital that can give you exactly what you need. Because what you want is that your doctor knows everything about the disease that they're diagnosing you with, about the process of treatment, about how to refer to others, etc. That's what's actually most important. And during a medical degree, people often cite these figures like doctors have less than X number of hours of nutrition education. But the question is, let's say you want to have doctors have 200 hours of nutrition education. What are you going to take it away from? Do you want them to know less about pharmacology? Do you want them to know less about anatomy? Do you want them to know less about physiology? Do you want them to know less about microbiology, etc., etc., etc.? The thing is, with a medical degree that's really difficult to understand from the outside, is that you are trying to learn such a ridiculous amount of information, going both broad and deep into different subjects, so that you come out as somewhat of a generalist that can then specialize, that adding anything else in is such a difficult decision to make. Because people will argue you should have more exercise education. Then people will argue you should have more nutrition. You speak to physiotherapists, they'll say that doctors don't know enough about musculoskeletal diagnoses. You speak to a psychologist, they'll say doctors should know more about psychology. So as you go into these different areas that are very much related to medicine, you could absolutely make a case that a doctor should know more about that individual area. But the problem is you can only do so much. So I think what actually works better is conceptualizing a framework in which a doctor is actually really well able to do what is within their scope. If they happen to get more education and exercise and training and they understand that, that's fantastic. But what you really want a doctor to be able to do is to appreciate that there is a role for exercise and nutrition, and then to refer on accordingly. Okay, so that's kind of what people should focus on more, is that rather than the doctor being able to like give you an exercise program, that they realize that, okay, this patient here that has problems with their heart, I'd love them to be exercising because that's really good from a preventive perspective, and there's a cardiac rehab program that I can refer them to. Or if someone has a lung disease, there's a pulmonary rehab program I can refer them to. So that's really what's far more important, I think, because you can make the case that any profession should know more about a wide array of things, like physiotherapists that are working with people, let's say, that have obesity and they might have joint problems related to their obesity. Should they know more about nutrition? Yeah, that'd probably be beneficial. But again, where do you slot it into their education, and what are you going to take away from? Because there has to be something taken away, because trust me, there's enough to learn in medicine.
Yeah, and this is something that you see a lot. People will very often say, oh, doctors should know more about nutrition, they should know more about training. And that's fine, but there's two things we have to think about here. Well, there's three things. First of all, right, you're an electrician, right? If you're an electrician, you can fix the electrical circuits in a house. You know how to do, like, diagnose what the issue is. Oh, it's a blown fuse here, whatever, right? I'm not an electrician, but they're like, right, cool. I know what's going on. I know how to fix the issue. I know how to diagnose the issue, right? If I call up an electrician and go, yeah, my computer's broken, right? They're going to go, okay, well, like, I can maybe do some things if it's an electrical fault here. I can maybe do some testing. I have some tools that maybe I could help diagnose the issue. Maybe I could help point you in the direction. But that's not their speciality. That's not the thing that they're focused on, right? Now, that electrician that I call up might have a huge amount of knowledge, maybe really interested in, computers, how they work, knows all the things, right, and can actually help me, right? And that can be the case with your doctor, right? They can be really knowledgeable about nutrition, training, whatever, right? That's the first thing, right? You're asking the wrong person the question, right? Which brings me to the second thing, which is, why the fuck are you going to a doctor for nutrition training advice, right? You already know, right? You're already saying, you're like, oh, they don't get enough training on this. They don't get enough teaching on this, right? So you already know they're coming at it from a knowledge deficit. But also, who the fuck said it was their job, right? Again, I'm not going to go to that electrician and go, oh, yeah, fix my computer, and just presume they know what they're talking about, right? It was never in their teaching. It was never in their job title. It was never in their role, right? So as an individual, you shouldn't expect your doctor to know that stuff, right? Which brings me to the third point. What the fuck are doctors talking about this stuff? Why the fuck are doctors positioning themselves as if they know about nutrition or training or whatever, right? Now, I understand, yeah, you might want to help your client. You might be like, all right, actually, I want to provide them. I know exercise is important. I know nutrition is important. And I know I have like a knowledge deficit in this area. So how can I help them? Maybe you educate yourself on those different topics, right? But also, you have to remember that you're just a normal human. You're probably going to fall victim to the same fucking stupid nutrition fallacies and training fallacies and stupidity that everyone else gets to. Now, you would hope that a doctor has a bit more, scientific rigor and knowledge to be able to cut through a lot of the bullshit. They understand physiology, etc. That they'd be like, well, this is just stupid. But that's not always a guarantee. They might be a phenomenal surgeon. They might be a phenomenal whatever, right? That doesn't mean that they're going to be able to, understand the nuances of nutritional science, for example, right? You wouldn't expect them to. It's not their job, right? You're asking them to do the wrong thing, right? Current medicine, and I hate the way people talk about it, like this allopathic medicine, is really designed to treat these kind of like fast-term illnesses, right? In terms of like, okay, cool, you've got cancer, right? That's going to kill you in the next few months to a year. We know how to treat that, right? We have all these drugs, we have surgery, we have XYZ, right? Might not always work, but at least we know, right? Or we know how to treat it, or at least think about treating it. You break your arm, cool. They know how to do that. This is a fast illness, right? It's like, all right, you've broken your arm, I know how to set it, I can get you on your way. These kind of long-term illnesses, they're not as well placed to deal with them, right? A lot of the stuff, if you're coming to a doctor and you're like, oh yeah, I have high cholesterol, and you get your first testing at 50, right? You've probably had high cholesterol since your 20s, maybe even in your teens, right? So you've had this for the last 40 years, you know? Like, yeah, okay, now it's more of a concern because you're at a fucking 95% blockage in one of your arteries. So yeah, it's more of a fast term thing, but the actual progression of the disease was a slow progression, right? And that's where the current medical sphere is not really well equipped to deal with. And that's where this stuff like preventative healthcare, preventative medicine, whatever the fuck you want to call it, like really slots in, right? But again, it just comes back to that. Why the fuck are you asking your doctor to give you nutrition advice, right? Why are you asking your doctor to give you training advice? That's not their job, right? If you are a doctor and you're giving out nutrition training advice, why? Right? Yeah, okay, you can definitely point to stuff like the Eat Well guide and be like, this is what the government says, this is what nutritionists, dietitians, etc. have said is good. Fantastic. I presume you're able to do stuff like that, right? But if you're given the specific guidelines and you've never had education on it, like the absolute hubris to believe that you know more than people who have actually studied this stuff, right? I know a lot of doctors do have overconfidence issues despite lots of shortcomings, but you surely have the, this Hippocratic oath of like, do no harm, where you're like, okay, I should probably make sure that I'm not harming the individual by giving them these shitty fucking training and nutrition, advice that I just learned on fucking Instagram, which you see all the time.
Absolutely. And points 4 and 5 I'm going to make together pretty quickly, to be honest. And they are that this is kind of more for maybe wannabe medical students, because I know there are some of you. Like, medicine is both harder and easier than you think. So I'll explain that. Number one, it's harder because I think that you actually end up covering a lot more ground in a medical degree than you'd expect, even that I expected. And like, that was coming from physio, that was knowing medical students, knowing doctors. Like, I didn't realize how much depth there would be in so many different subjects. Okay, so that's the first thing, and there's not really too much else to say that I haven't covered already, because I already mentioned that there's so much depth to cover. Like, where would you take things away from? Okay, so it's related to that point. It's harder than you think, but it's also easier than you think. And what I mean by that is that when you're studying a subject on your own, we've talked about this before, like, self-education is great. I really like self-education. I know you do too, Patty. But when you have a specific framework to follow, you have exams, dates, deadlines, mentors, etc., and peers that are on the same path, it's actually a lot easier to cover a lot more ground than you'd expect. Okay, so when things are laid out well, in a formal education program, and you have practical experience in terms of being in the hospital to reinforce it, you'd be surprised how much you can learn incredibly quickly. So that's kind of the paradox there. You end up learning a lot more than you could ever expect you'd fit into your brain, but you also think back and think, God, that actually, I'm surprised that happened, but it didn't feel like it. 4 years flies by. Okay, so bit of a paradox, but both those things are true, I think.
Yeah, and I'm a big fan of self-guided education, but I do think some form of directed education, even if it is self-guided, like say for example on our nutrition course, it's directed education in terms of, I'm like, right, you need to know all these different things. I don't care if you breeze through this. You're just like, right, I already have a good deep understanding of this stuff. I'm just going to hit the main points of it, skim this, watch the video, fantastic, see you later, right? I don't care if you do that. It's at your own pace, right? You might be like, right, this is a completely new topic to me. I need to spend way more time understanding this. I'm going to read all the references, extra readings, and et cetera, that these guys have provided, right? So having directed education is phenomenal, right? And the good thing about medicine, at least from an outside perspective, is that it is actually outcome based, right? In terms of you have more immediate feedback, right? Because most people, when they interact with, higher level education, it's they end up just doing a load of meaningless tasks. Like, the vast majority of 4-year degrees could probably realistically be done in 1 year, right? Like, the vast majority of them, right? Now, some part of that you could argue is like, oh, well, you're supposed to be like, learning to interact with others and, developing as an individual. I would argue that, paying for university to basically get access to a social club is probably not the best use of your money, and could be done in far better ways, like literally just join a social club, right? Or a sport or whatever, right? But it still has its advantages, right? But the way most people interact with the education, third level education, further education, or whatever, is unfortunately they get exposed to a lot of just busy work, just like, oh, write an essay on this thing, and 2,000 words or whatever, right? And it's meaningless at the end of the day. It's not actually teaching you anything. Like, yeah, it might teach you some kind of like soft skills in terms of like, oh yeah, you should use PubMed for research and different things like that. But it's not actually teaching you what you're supposed to be learning. Whereas I feel like in medicine, you just don't have the time to waste. You don't have the time to be like, oh yeah, we'll get you to do these like shitty assignments. Like I'm sure you do have lots of shitty assignments. It's just that's the way universities in this day and age they like to like to work, right? It's just like it's administration basically, right? But it's still way more outcome based in terms of you can see if you know stuff or you don't know stuff, right? Like you're going to be, here's a case study, what are your initial thoughts on this? Explain your reasoning, your rationale, fucking whatever, right? What are you going to do? How are you going to diagnose this person? What testing, what further testing, etc., right? And you're given this more immediate feedback, and it feels, or again, from an outside perspective, it feels like that's a lot less busy work and much more like application. It's much more akin to like a trade, like you'd learn to become a welder or something, rather than learning to be like, even like my degree in like biochemistry, right? It's just, there's a lot of busy work, it's like, okay, yeah, you have to learn to do experimentation and fucking whatever, but also I could just learn that in one class rather than an entire semester.
Yeah, I totally agree with your assessment. Totally agree. And the next one, number 6, is getting answers to niche questions about your health or your disease almost always requires a one-to-one interaction in some way, or one-to-one attention. And this is actually something that I wanted to discuss because it's a particularly modern problem. We have such vast access to information, but also such vast confusion. And if you go online and ask, how should I deal with my high cholesterol, you're going to get such contrasting opinions, even from people who have medical doctorates and PhDs in front of their name. So what I would suggest is that if you have an individual health problem, you have a disease, just get someone that is a specialist in that area. Ideally, of course, they're well trained and they're following the evidence, etc., to guide you on your individual case. Because researching things online can be incredibly confusing, particularly because of this problem where there's different thresholds for treatment. Okay, not all problems get treated immediately. Not all problems require treatments. Not all problems are even problems depending on who you are, your current status. So I would encourage people that if you're having problems with your health, just try to get personal help. Try not to, outsource to the hive mind. Sometimes that can be incredibly helpful, but in the vast majority of cases, if you just go to your GP, get an appropriate referral, get the scans that are required or no scans if not required, you're probably better off. It can be frustrating. It can be a slow process. That's one of the things that people often get frustrated with is, God, it takes so long to see my GP and then get the referral. Totally appreciate that. It can be frustrating, but spending all of your time trying to self-diagnose and come up with solutions online just often leaves people worse off.
Yeah, and that's not to say that you shouldn't do that. It can be part of the process, but I think it is way more beneficial for the vast majority of people to actually just talk to an expert. Getting access to the expert, again, it might take time, it might be whatever. Like that's the trade-off if you want to have this socialized medicine that we have. It's like, okay, cool, like everyone wants access to these people, so join the list, right? The only circumvention of that is to have buckets of cash so that you can get private, you can consult with these experts because you're paying them, right? So that's the trade-off. If you have buckets of cash, go straight to the source, you can pay, you can get a consultation, right? That's the system that we have. If you don't have buckets of cash, again, just you have to join the queue, right? You might be pushed ahead of the queue because, the issue is more, immediate or whatever, but it's still a queue, right? But even outside of medicine, I think this applies to so much. Like obviously we coach a lot of individuals for health and fitness stuff, and obviously we would say this is part of the healthcare system, etc. But you see night and day differences in terms of when people come to us, they've been like, oh, I've been doing my training, I've been doing my nutrition myself for the last couple of years, and like I've never been able to crack it. I haven't been able to like really get the the information that I need. I haven't been able to get the results that I want, etc. And they come to us, they work with us for a couple of weeks, and they're like, fuck, you've really shown me exactly what I need. You've really shown me exactly what needs to be done, what boxes I need to tick, and you've really brought the process down to an individual level and shown them the key things that they need to focus on, shored up the key weaknesses that they have so that they can actually get the results, right? And some of this is a self-discovery process. Like they're like, oh, well, I've learned these things about me. I know this exercise doesn't work for me or whatever. So again, we're not saying that a self-discovery stuff is bad, right? But if you have someone that is educated in the topic that you can communicate with this stuff, fuck, it makes it so much easier. Like if I had an injury, like I just got a crippling injury that's going to be a long-term injury, like I know a lot about rehabbing injuries. I've rehabbed so many people's injury or helped in that process. I know how physiology works. I know how the human body reacts to different stimuli and the adaptations that I potentially would want for rehabbing a long-term injury. I would still refer out and get someone else to guide the process, and now you might say that's my privilege in terms of being like having money and stuff to be able to do that, but it's still emblematic of what we're talking about, where like I have the knowledge and maybe I could do it myself, but being able to just discuss things and get the help of someone that's an expert in this field, like there is no comparison.
Check. And next up is kind of circles back to something we discussed previously, but it's just the idea that preventative medicine includes medicine. Okay, this is really important, because if you're trying to adopt a wholly preventative approach and it only includes training and nutrition, you're actually missing out on a lot of things. Easy examples, again, like vaccination is just such an easy example. Like let's take HPV and cervical cancer. The population studies on the effect of like mass HPV vaccination, it shows a dramatic drop in cervical cancer rates. That is really important because it's a cancer that can kill women at a very young age. Okay, and that's not nice. No one wants that. And HPV has been incredibly effective there. It's also basically eradicated genital warts, because HPV again causes genital warts, which is just a nice little benefit that people get as well. So these are just examples. Like there's loads of other vaccines like people would be familiar with, but that's just one example of where medicine actually fits in with a preventive approach. Similarly, if we're talking about blood pressure, because this is something that people that often don't think about, they think that this is like blood pressure. Okay, we're treating blood pressure. You don't treat blood pressure for blood pressure's sake. Okay, if someone has high blood pressure, you're treating it to prevent complications down the line, like heart disease, like stroke, etc. Okay, so it's still a preventative approach to measure and treat blood pressure, even if it includes medication. That's still preventative medicine. You're preventing a future disease state. The same with something like statins. If someone needs to take a statin because they have high cholesterol, that's preventative medicine. You're preventing heart disease down the line. Okay, so I think sometimes there's like that dichotomy between like reaching for a medicine to treat the disease versus doing something with your lifestyle to prevent disease. Medicine also prevents disease. That's a really, really important point.
Yeah, and I think personal trainers actually, don't really grasp this a lot of times. Like they'll do things which is not necessarily inherently bad, but they'll be talking to a client and they're like, oh, my client, the client is saying like, oh, they're on blood pressure lowering medications, and the personal trainer will be like, cool, we're going to be able to get you off of those things, right? You don't need to take those things. We're going to do exercise, nutrition, etc., and get you off all of those medications. And that might be a goal for that individual, right? That it very much might be the case where they're like, look, I really don't like taking them. Maybe I get some side effects of them or from them, and I just don't like the cost. Especially if you're in a different medical care system that isn't like the Irish or the English system or whatever, and you're like, all right, it's just not for me. I want to be off these medications, right? Yeah, if you can play a role in that as a personal trainer, happy days. However, if these drugs are helping prevent disease for that individual, you don't necessarily need to come off them, right? Yeah, for sure, we want to monitor how we're getting on. If you're going to be like, all right, we lost some weight, we make changes to the diet, you have like a lower sodium diet, you're managing your water intake, for example, different things like that, where you're like, oh, all these things help with blood pressure, and you've got them to a level where, maybe they don't need blood pressure lowering medications anymore. Happy days, right? But I think personal trainers get very caught up on thinking like, oh, I want to be able to get my clients to a stage where they no longer should need medications, and it's a noble like outcome, right? And for something like blood pressure lowering medications, potentially that's relatively easily achievable, right? But it does pervade into all these other fields. We were like, we'll get you off those statin medications with just dietary interventions, and exercise, right? And both of those things are beneficial in lowering your LDL cholesterol at least, but that doesn't mean that's not going to get over your like fucking familial hypercholesterolemia. It's like there's some people are just going to need to be on medications. As a personal trainer, you don't need to take people off medications or promise that you're going to get people off medications or even have that as an outcome. Again, you can be supportive of it, but if we are going to move into this like healthcare approach to personal training, you have to realize that the doctor does also know what's best for the client, right? Like they put them on this medication for a reason, right? And if you're going to be someone that the doctor trusts to refer out to, like you need to be educated or smart enough to realize that I don't need to promise my client that I'm going to take them off their blood pressure lowering medication,
Yeah, and the important thing for both trainers and doctors is to remember the goal. What's the goal? The goal is to live well for as long as possible. Okay, we want to promote health span and lifespan. And sometimes I think people get attached to the wrong goal. They get attached to promoting these things, but via certain methods. We see this in personal training all the time. But in this case, the doctor might be thinking, I don't really want to focus too much on nutrition or training or supplements or whatever because that's all quackery, all that stuff. I'll just focus on what I do. And then the personal trainer might be saying, oh, I want to make sure that they adopt just this like natural approach. So you're focused more on attaching the goal to the method rather than the goal with the outcome, because the outcome is really what's important for the client or for the patient. It's similar to what we talk about when if someone's trying to build muscle, what's the goal? To build muscle. So if a low volume approach works for you, Paddy, and you've always found that just worked better for you, and I find that a high volume approach works better, but we're saying that, oh well, at Triage we only promote low volume approaches, so I'm only going to focus on that. Well, then we're not sticking to the goal. We're getting attached to the method. So that applies to both personal training and to medicine as well, I think.
100%.
So that brings us to something that was a theme in our discussions at Triage before I ever did medicine, which is that an abnormality, whether it be on a scan, on a blood test, or anything else, does not necessarily imply the need for treatment. Really important. This is something we've talked about a lot in relation to pain and injury in the past. So, for example, you go for a scan and it says, oh, you've got an L4, L5 disc degeneration, or it shows some sort of tendinopathy-like changes in your adductor, let's say, or you've got a little bit of arthritis in your knee. The presence of these things, one, does not necessarily correlate with symptoms. Two, does not necessarily correlate strongly with that getting worse or progressing to symptoms in the future. It obviously increases risk, but it's not one-to-one. And then three, it doesn't necessarily require treatment. Really important, because this is something that we've talked about in relation to injury in the past in those examples, but also applies to more medically focused topics. Examples would be, you could get an MRI for an unrelated problem, and then a small little lump is identified, let's say, in your liver, or identified in your lung, or identified in your adrenals. And this is something that's been identified. It's not clear whether or not this is going to progress to anything like cancer over time. It's benign for now. We can't predict the future, but a doctor might make the assessment that this is a common finding that we see. It's very rare that it's going to progress. We'll monitor. It doesn't necessarily require treatment. Okay. Similar things would be like thyroid lumps, for example. People might freak out. They think, oh my God, my thyroid. It might be totally benign and might not require any treatment. Other common examples in medicine would be things like cancers in older age. So, for example, the presence of prostate cancer in an older man or the presence of a breast cancer in an older woman. Sometimes these things don't even get treated because it comes back to what we discussed earlier in terms of risks and benefits, that the risks and the effect of quality of life on quality of life of undergoing treatment would actually outweigh any benefit that the person is going to have within their lifetime. So they would have died with the cancer without it becoming symptomatic. So that's something that's really important and is really nuanced and individual to every individual case. But I think it's actually quite a powerful realization.
Yeah, I don't have anything to add to that because it's spot on.
Perfect. And number 9, doctors, in inverted commas, are far from a homogenous group. Okay, this is really important because I see this all the time online. People say doctors believe, doctors think, all doctors are like this. It's just not true. Okay, that's something that people think before they go into medicine. For example, only the let's say it's only the nerds, it's only the real like book nerds that end up going to medicine. Or if you're in medicine, maybe it's that all people are of a particular political affiliation or all people have these beliefs. These things do exist to some degree. Like, for example, if you think about like political views, like most doctors have left wing, more liberal political views. But what's so interesting is that if you look at studies on like political views or views on different social and political topics among different professions, you actually see a kind of a predictable distribution where surgeons, who generally tend to be more male, also tend to be more conservative. So you have more conservative surgeons, generally more kind of right wing or libertarian leaning beliefs, and that then becomes more extreme in certain surgical professions. For example, neurosurgery and orthopedic surgery. If you compare that to something like, let's say, pediatrics, psychiatry, and some other medical professions, tend to be more left-leaning, liberal people. Okay, that's interesting because it ties in with like the kind of psychological profile that you expect to affiliate with some of those groups, and that doesn't mean again that every surgeon is like right wing, like Republicans or anything. Far, far, far from it. But you see a distribution there, and that's something that's important because I think sometimes people think that doctors are a particular type of person, but a doctor, it's not an adequate descriptor because medicine is a really, really broad field, and the difference between someone like a pediatrician versus a radiologist versus a pathologist versus a surgeon, they actually have very often there's clear and sometimes predictable stereotypical personality differences between these individuals, and that's something that I think is important to grasp.
Yeah, and also it is one of those things where whenever you hear someone say like all people in this group believe this, like if you're like all feminists believe this,
Yeah.
all fucking Nazis believe this, like
Yeah.
all X group believe this, it's that raises some questions, right? It raises some questions about the person stating that. It raises some questions about, okay, well, why do all of the people in this group? You're telling me there's absolutely no dissent in this group. There's no questioning this belief. I'm like even 99%. Are we saying like it's literally every single last one, right? There's not even one guy that's like, no, I don't think that. Like even in like when they market to you and they're like 9 out of 10 doctor or 9 out of 10 dentists, recommend this whatever toothpaste. It's like they said 10 out of 10. I'd be like, did you pay these people? Did you like just get rid of all the people that said no? So just from they always say the classic like sniff test, like is this t-shirt good to wear? Oh yeah, it's fine. Like that kind of all or nothing kind of mentality, thinking about certain professions or certain beliefs or whatever, like it just doesn't pass the sniff test. You're like, I find it very hard to believe that everyone is the exact same.
Yeah, absolutely, and that's something that applies to like personal trainers as well, because I think some people have stereotypes about personal trainers that they're these like they're these gym bros that just shout at people and tell them to work harder and don't pay any attention to like social contributors to health. And it's like, no, not all personal trainers, okay? Same for doctors, right? So that brings us to the final point, which is again related to the process of studying medicine, but also relevant to anything that you're pursuing yourself, and that is that you can do more than you think you're capable of. Really important, because I never thought I'd be a doctor. What I'm thinking, what the hell? How'd that happen? You know, how did we get here? And like, I was not that guy in school. That's not how I grew up. When I was in secondary school in first year, you know, kind of some of my friends, you know, kind of messers, you know, boys, lads, kind of crack would be going on, and like one of my teachers at the time, the first parent teacher meeting I had in secondary school, he said to my dad, he was like, look, like Gary's just not the academic type. Like it's just not really for him. That's not who he is. And my dad thinks that's hilarious now. But that's important, because it goes back to what I said about, like, doctors are not a homogenous group. Okay, you don't have to be the nerd. Similarly, you don't have to be like the jock meathead to be a personal trainer. Okay, there's different ways of living in the world, different ways of presenting yourself in the world, and that's fine. And whatever it is that you're pursuing, you can probably do a lot more than you think you're capable of, and not to count yourself out because of, you know, whatever it is, the way that you grew up, where you grew up, you know, the color of your skin, whatever. These things are not discounting factors from you being able to become the person that you want to be. So drive it on.
100%. Anyway, Gary, I don't have anything to add to the top 10 things that you learned from your medical education. So if you want to wrap this up, tell people where they can find us, all that kind of stuff.
Yeah, so as always, guys, well, not as always, right now, we have a lot of coaching spaces available. I've just finished medicine, as you may have gathered in this conversation, and I've got a lot of availability myself. The other coaches have availability as well. So if you'd like to work with us, now is a good time. We're coming into the summer. Some of you might have maybe quieter time at work. It might be a great time to focus on your goals. So if you'd like to work with us for training, nutrition, rehab, or all of the above, you can get in contact at the link below, pop in your details, and you'll find all of our client testimonials and everything down there as well if you visit our website. So other than that, we put out a lot of free content. You guys know that. We've got the Triage Method newsletter. I hope you're subscribed. We're putting out the podcast weekly, so make sure you're following. Leave a rating and review if you like it. Share it if you like it as well. We put out a lot of stuff on social media at Triage Method and on our own individual pages, so make sure you're following on socials, along with our YouTube channel, the Triage Method YouTube channel. And then finally, we still have our nutrition course open for anyone that would like to become a certified nutritionist or nutrition coach with Triage. So if you'd like to level up your nutrition knowledge, maybe you're a doctor listening to this and you're thinking, you know what, we actually didn't get much nutrition education, but I'm going to subscribe to the boys, then yes, we do have course spaces available as well.
Yeah, I should just note on that the course is closing relatively soon. Like, there's no definitive close date as of right now. But we're going to be going through some massive updates for it. Not that it isn't already absolutely phenomenal, but there's a lot of things that myself and Gary and the team have been discussing in terms of what we would like to see in there, what things we think could really enhance the experience. I've been chatting to a few people that are already on the course, and they're, you know, getting their feedback, being like, okay, well, I didn't really understand this topic, so maybe we're going to flesh that, you know, section out a little bit or whatever, right? So some massive updates coming, but to really, you know, put those updates into practice, we need to close the course for a while. You know, it's probably going to be closed for about 6 months, and then when it opens again, the price is probably going to go up because it'll have got a massive update. So if you're interested in locking in the current price, you kind of need to act fast. You know, I wish I could give you a definitive date being like, oh, it's going to close on this date, but we haven't decided on that exactly right now. We're going to be deciding on that next week, the week that this podcast comes out. But as of right now, we don't have a definitive close date, but you need to kind of act fast if you're interested.
Yes, sir. And that's it.
Fantastic. Anyway, guys, we will see you in the next one.